We find 82-year-old Aidah doing what she has always been doing for the past 65 years, in her midwife attire. She is not quitting just yet.
Until die. It's from my heart.
And it puts daily bread on her table. She dreams of years past when she did not have to mix passion with money.
150 shillings per month was a good enough for us, because you can get free house, you get the money to eat and you put it in the post.
This adequate salary is what most old practicing doctors in the profession allude to. Dr. Paul Dabela is one of them. He started his medical career in 1960 when he qualified at Makerere University.
Health service had been very well planned during the colonial days.
Dr. Kanyerezi, a consultant physician, emphasizes the motivational factors which are no longer there, like the living wage.
They were fully paid while doing the postgraduate. So they had every reason to stay around. But now, doctors are actually just doing a national service there and have to go elsewhere to earn a living.
Less than 6 months after independence, when 77-year-old Dr. Kanyerezi started his calling, the population was manageable, and the full ward meant 50 patients plus a few outpatients.
When you compare now, those wards are about 200 patients.
Indeed, the population was less than 8 million when Dr. Kanyerezi joined the practice in 1963. Now, Uganda's population, one of the fastest growing in the world at about 34 million people, is too much for the few doctors to handle. Hospitals were there, built by missionaries. Mengo, as early as 1897, built by Sir Albert Cook. He also put up Mulago Hospital in 1913, specially to treat sexually transmitted diseases, which, according to Dr. Lawrence Kagwa, a former director at Mulago Hospital, were rampant.
They had been brought by the Arabs, I think, and gonorrhea was so much. There was so much gonorrhea, there was so much syphilis.
Makerere Medical School was formed in 1922, and in 1927, the first 3 black African doctors graduated. All were Ugandan.
Bamuje, Bamundaga, and Baziwane, the 3 Bs, south of the Sahara, including Nigeria and all these Ghanas. These people are just talking now. This country was very developed.
Doctors were the most respected, and they made an effort to know their patients. The pre-Amin days were indeed the best, and if you're a patient right now, you'd wish to have lived in the 60s or before the 60s. However, health professionals say that with the coming in of Idi Amin in 1971, everything in the health sector got shattered. For Mulago Hospital, there was a serious drawback, hard to recover from. Things began smoldering and got awry when the Asians were kicked out of the country in 1972.
Many doctors were Asian and eventually even chased away the whites.
All the other expatriate doctors left in sympathy.
There was service deterioration, which did not only affect the staffing, but also the equipment.
Petty pilfering took place. Mattresses, bed sheets, blankets disappeared.
With no funding from the foreigners, the sector crumbled. Equipment went into disrepair. Without servicing, Amin had sought to outrightly put the economy in the hands of indigenous Ugandans, but it came with unintended consequences.
I think the principle was good and every country does it. But the way he did it was very traumatic.
The first cases of the fatal Marburg virus, similar to Ebola, were discovered by Dr. Kagwa and his team in eastern Uganda. However, only the World Health Organization intervened.
I was very surprised to hear it from Amin, because this was a Moruka called in Nakibembe. That's the Moruka for Shaban and Kud. So Amin took it very lightly and said, oh, but God is avenging the evil that Shaban and Kud did in this world.
Shaban Nkutu had been the Minister of Health from 1966 to 1967, who contributed tremendously to the health sector during his tenure.
For God and my country.
To Dr. Kagwa, the return of Obotetu in the 1980s was as good as useless. According to Kanyerezi, many doctors were murdered.
When it came to my turn, somebody said, you know, this decision has been taken. We got the message at 6. We went out of this house at 7. They came at 9.
Unlike many doctors, he traversed other countries for security and better pay, still wondering at the killings, while the sector continued to suffer.
And it has left scars up to the present time.
I think this is a fundamental change.
Stability returned in 1986 under the leadership of President Museveni. The health sector began getting better.
And it has been an uphill task, starting from the mess that was left.
A vigorous attempt to revamp the National Referral Hospital started. To Dr. Kanyerezi, health is however not prioritized at all, as Mulago continues to seek services from small private hospitals.
Why should they go out begging or transfer a patient, go to Kampala Hospital, have MRI, come back, we'll operate on your brain? It shouldn't be that way.
Money has been pumped into the heart and cancer institutes. More health centers have been constructed, though short of health workers. Funds have also been pumped into public health, particularly to stem HIV and AIDS, which mainly manifested in the 80s, but it has been costly. To the oldest midwife, though, the interventions have paid off.
There is a change this 50 years for a woman pregnant when he's having HIV, getting PMTC. The baby cannot get the infection for AIDS.
But the health worker who administers these drugs stays the least paid.
And you cannot blame them for doing after-work practices.
When you underrate somebody for too long, that individual gives up his pride. And I think a number of them are losing their pride.
Efforts to double a doctor's salary this year for some were a step in the right direction.
For sure, I work at Zambia, and a doctor who has finished his M.Med, that's the Masters of Medicine, he started at barely $500. If he goes to Rwanda, he gets $5,000. If he goes to Kenya, he gets about that plus allowances.
Among measures this suggests to salvage the situation is lifting the morale of the health workers and delivering drugs in the hospitals.
Instead of showing just stocks in National Drug Authority, I mean anybody.
To have an effective system, they assert that all stakeholders should be consulted during policy making.
The policies are very good. In fact, other countries are coming to copy policies from here. And then when they go home, they apply them.
They are also called to review the health budget, which according to the Abuja Declaration, to which Uganda's government is signatory, should take at least 15% of the national budget.
But we are still hovering between 8 to 9.5. Why don't we go to 10 and then go to 11? And be seen to be moving.
The policy that I launched.
A new policy being mooted is the public-private partnership, as government looks to the private sector to reduce gaps. But some doubt it will work, as private facilities stay ignored by the Ministry of Health.
They don't know. They don't go there. So, what sort of partnership?
But will it ever be any other way? The recent discussions on the health budget are worrying.
This year has demonstrated clearly that things are not going to change soon.
If the profession continues in shambles, people like Nema will continue with this line of thought.
When I get sick, I think about money.
Why?
Because I can't go to the hospital without money.
So what would it take for the health sector to get better than the 60s and earlier years? Would paying doctors better be the magic bullet?
We are not there to a satisfactory situation which will stem the brain drain.
Florence Naliba, NTV,